Hello, and welcome to Cardiac Conversations, Advancing Pediatric Heart Surgery Recovery with Innovation. Thank you all for joining. My name is Laurie Davis, and I am the nurse coordinator at Boston Children's Hospital with the Enhanced Recovery After Surgery program. I'm very excited to facilitate today's discussion with our expert panelists that we have here. They're all part of the Enhanced Recovery program. Today, we will discuss how teams at Boston Children's Hospital deliver innovative care, performing advanced surgical procedures with new recovery protocols to improve results and accelerate recovery for children. We will discuss how children and families can prepare for their procedure and hospital stay. Then at the end of the webinar, we will open it up to the audience for questions. So please feel free to put any questions into the chat at any time or into the Q&A. And then at the end, we'll be ready to answer them. And in case you're not able to watch for the entire duration of our conversation, this is being recorded and will be available on Boston Children's Hospital website, as well as the Boston Children's YouTube page. I will now let the speakers introduce themselves. Dr. Roy, as our first panelist, would you like to start?
Thank you, Lori. My name is Natalie Roy. I'm one of the cardiac surgeons and a critical care physician in the cardiac ICU. I'm the director of the Enhanced Recovery Program and was one of the people who joined this coalition of care providers to enhance recovery after cardiac surgery. Dr. Atkinson?
Yes, hello everyone. My name is Doug Atkinson. I'm one of the cardiac anesthesiologists and cardiac intensivist at Boston Children's Hospital. I currently serve as the director of the cardiac post-anesthesia care unit and lead a lot of the cardiac anesthesia regional anesthesia program initiatives.
Mags?
Hi, my name is Mags Margaret Adamczyk, and I am a nurse in the procedure unit at Boston Children's. I worked in the cardiac ICU for 25 years, and I've been here as a bedside nurse for the last 3 years.
Perfect. And Kelsey.
Kelsey.
Hi, I'm Kelsey McNaughton. I'm one of the nurse practitioners with the surgical team out in the acute cardiac care unit. And I used to work alongside Mags in the ICU as well as a bedside nurse before. I've been in this role for the past 5 years.
Awesome. Thank you, everyone, so much. Thank you all for being here. Let's start with you, Dr. Roy. What is enhanced recovery after surgery, and why is it important?
Thank you, Lori, for this question. I'm going to use a few slides, and I'll try to keep that to the minimum. But the enhanced recovery after surgery, specific to children's heart surgery, was developed and implemented here approximately 8 years ago, although we've been talking about optimizing the care of our post-operative patients for a few years leading to that. And the goal was to help patients with the best approaches to care, but in a coordinated way so that we can improve their recovery process at the hospital and also after surgery. And the goal obviously was to ameliorate recovery, which leads to shorter time needed to be in the hospital and also improve family experience. The program focuses on a coordinated approach that starts in the preoperative setting with education and expectations where with your cardiologist you discuss the hospital stay. And it includes protocols that aim at reducing the stress of surgery and ease recovery. I'm not going to go into the details of all the specific protocols and element of care here because we're going to discuss this throughout this webinar. But the goal is to enable faster recovery and improve confidence after surgery. Why does it matter? The main thing that we've been able to do with the program is provide excellent pain management with less opioids. And so with this program, and we'll talk about the different approaches, we've been able to reduce opioids during and after surgery very significantly with excellent pain management. And further, the other important part of this is to partner with patients and family in their recovery by providing education ahead of time about the program, such as this webinar, but also through our website and our mobile experience before and after surgery. So I'm going to end the slides here, and we're going to have discussions about all these elements of care that I just discussed.
This is great, Dr. Roy. And Dr. Atkinson, I guess this would be for you. Who are the patients that benefit from the ERAS protocol?
Yeah, that's a good question. So, I mean, the honest answer is most surgical patients can benefit from enhanced recovery after surgery protocols. The size of the benefit may depend somewhat on the patient's health, the type of surgery they're having, and really their baseline risks. So perhaps on one end of the spectrum, there are patients who are relatively healthy without many medical problems and maybe undergoing a really lower complex elective surgery. And these patients benefit from the enhanced recovery protocol and often have better and faster recovery. Some examples would be that we have found in this lower complexity group are patients that have vascular ring anomalies or ones that may be undergoing a more simple heart surgery like a repair of an atrial septal defect. But even on the other end of the spectrum, patients that have significant medical problems or are undergoing a really highly complex surgery or procedure, they also benefit from components of ERAS or enhanced recovery. It's just that the protocol has to be individualized to their recovery needs.
Thanks so much, Doug. Lori, maybe you can explain to our audience, how do patients and families learn about the ERAS program and what to expect prior to surgery?
That's a great question. So we really focus on education before surgery. We want families and we want patients to really be prepared coming in. Initially, your surgeon and cardiologist will kind of discuss your case and your recovery and decide if you're a right fit for the ERAS program. Then about 1 to 2 weeks before surgery, you'll get a phone call from the preoperative clinic team. This phone call, they kind of go through some general things prior to surgery, and then they'll mention the ERAS program a little bit. Then as the surgery date gets closer, you'll have an in-person visit with the preoperative clinic. And this preoperative clinic day can be a little overwhelming. We do give a brochure, and the nurses will go over a little bit more about the ERAS program and answer any questions you may have. But because this can be such an overwhelming day for patients and families, we've developed an application within MyChart or My Children's, as it might be called, that actually has all these education pieces, has our link to our website, a welcome brochure, a little bit of everything that you'll have access to, again, about 1 to 2 weeks before surgery. And you can reference this application at any time. You can also email us at the end of the webinar. I will provide some of our contact information for anyone that's interested, or if you have any questions and want to reach out. Now, let's switch gears a little bit and talk about what happens on the day of surgery. Margaret, on the day of surgery, patients will come to the post-anesthesia care unit before they go to the operating room. Can you tell us a little bit about your unit and kind of what the process is for patients and families?
Okay, yeah. So on the day of your surgery, you will come to the Hale building, the 6th floor of the Hale building. You'll check in there with the girls at the front desk, and then they'll direct you just to sit in the waiting room and wait there. And one of the nurses that's been assigned to take care of you will come out from the unit and we'll bring you in. Now, we only have two family members, like typically mom and dad, come in with you and your child, and then we'll bring you into your room and we will get you and your child, we'll get you ready for the surgery. We find out relevant information like when was the last time your child had last had anything to eat or drink. We'll review all the information we have with you, and it's also the room where you get to meet the OR team and anesthesia. And once all these things have been done, then this is also the room where once your child is like sedated or a little sleepy, then they'll go off into the OR, and you will be able to go and do what you want as well for while you're waiting.
Gotcha. So while they're there, they'll meet the anesthesiologist like you, Dr. Atkinson. Can you describe a little bit about your role as the anesthesiologist during surgery, and what are some different approaches your team takes to help enhance recovery?
Yeah, of course. In short, an anesthesiologist is just a perioperative doctor who focuses on your safety, your stability, your comfort anytime a patient needs anesthesia for surgery or another procedure. So some of the core responsibilities of the anesthesiologist are to evaluate the patient preoperatively before the surgery, review their history, examine them, create an individualized plan that accounts for their conditions and needs. During the surgery, of course, the anesthesiologist administers anesthesia medications to make the patient unconscious or sedated for the duration of the procedure. We monitor vital body functions like the heart rate, the heart rhythm, the blood pressure, the oxygen, all these vital body functions. We make adjustments to drugs and interventions really minute to minute throughout the surgery to keep the patient stable. And we, of course, respond to emergencies that occasionally occur during a surgery. And then after surgery, we oversee care in the recovery area, including ongoing monitoring, treating any discomfort, and treating nausea. I guess more specific to the program of enhanced recovery after surgery, anesthesiologists are central to this ERAS protocol because they design and lead many of the interventions that blunt surgical stress, that control pain, and that maintain, patient stability across the perioperative period, across the preoperative, intraoperative, and postoperative period. So, like I said, we optimize patients before surgery by assessing their medical conditions. We choose and deliver anesthesia medications in a balanced way, using different types of medications with the overall goal of really minimizing the stress and facilitating their emergence from anesthesia, their waking up from anesthesia. And this often means we emphasize shorter acting anesthesia agents. It often means we emphasize using regional nerve blocks. Those are numbing medicines that can be injected at sites around surgery to help with comfort, both during and after surgery. And we implement, the use of different medications and regional blocks so that we can reduce the amount of opioid medicines that are used, because we know that opioid medicines have some undesired side effects. It's not that we eliminate their use, it's just that we incorporate other techniques to treat analgesia, to treat pain. Another important part of the anesthesiologist role is helping to decide when it's appropriate to remove the breathing tube that we use during the surgery. And that sometimes is done in the operating room at the end of surgery, and sometimes it's done later in the intensive care unit, depending on the expectations for that individual patient. I think that's mostly what I can think of.
Yeah, I definitely want to get back to ask you some more questions about the breathing tube. But while we're talking about everything that your team does to help enhance recovery for patients, I want to take this opportunity to ask Dr. Roy how the surgeons also help patients, dealing with pain, and how to accelerate their recovery after surgery.
Thanks for that question, Lori. I think the I think important thing for families to understand and patients to understand is that the surgeons and the cardiologists before surgery will review your patient's heart condition and will come up with a approach, and they'll determine together whether or not it is feasible for your child to go through ultra rapid recovery versus still participate in some elements of the program with a recovery that may require you to keep the breathing tube past the surgery for a little bit longer. And that will be also shared with the anesthesia team and coordinated with the intraoperative or nursing team so that we can really optimize and hone in on the best approach to treat your child. Specific to the surgical approaches, some patients, and I'm going to share another slide, some patients are eligible for smaller or different surgical approaches, whether it's through the chest or through the front. Sometimes we can use smaller incisions that don't require to cut the entire breastbone, or can go through the ribs so that we can perform the surgery with excellent visualization of the structures. So when it's feasible, the surgeons will consider these techniques to perhaps reduce pain or improve their visualization of the procedure. And some of these have sometimes some cosmetic advantages in addition. But regardless of the approach, as Dr. Atkinson said, we still will focus on pain management with the use of local infiltrations, and more recently, really by developing a really broad protocol for the use of regional anesthesia. So it's the same pain infiltration, but is given in a more regional fashion with the use of ultrasound, and our cardiac anesthesiologist really leading the way to try to minimize pain after surgery with multiple approaches, basically. So from a surgeon perspective, I think that care coordination around which approach to use and what is expected for result that can lead to enhanced recovery is really how we participate in this program. It is important to know that all the patients who undergo cardiac surgery have an echo at the end of the procedure that determines that their repair is of excellent quality and the patient is able to come out of surgery, in the most optimal fashion. So that's a really important part of the program. And then I would say, finally, as our perioperative group includes also perfusionists to help us during the surgery to run the heart-lung machine, we've developed some protocols where we try to minimize the use of transfusions for certain patients that are big enough not to need to use blood during the extracorporeal circulation, and the use of cell saver techniques to help with that as well.
Perfect. So it seems like we're using a lot of different techniques and a lot of different strategies to help patients. I know, Dr. Atkinson, you briefly mentioned that some patients have the breathing tube removed in the operating room, and if not, most of the time they'll have their breathing tube removed in the intensive care unit within a few hours after surgery. Do all patients go to the intensive care unit after surgery?
Yeah, actually, it's true that not all patients need to go to the ICU, to the intensive care unit to recover from surgery. A lot of cardiac surgery still does require going to the intensive care unit. At this point in time, patients that have undergone surgery, cardiac surgery that involves using the heart-lung machine, the bypass machine, as a result of the perturbations or the abnormalities that can happen after those surgeries and those bypass procedures, they still go to the ICU for monitoring for some time. We found that some select patients, some healthier patients that are having less complex surgery, not having heart-lung machine bypass surgery, can actually avoid the ICU and recover in a post-anesthesia care unit, much like other elective surgeries people may be familiar with. So they go to the cardiac specific post-anesthesia care unit, or PACU, where the anesthesiologist oversees the recovery along with the surgeons and highly skilled nurses that are familiar with patients immediately after anesthesia.
That's great. So, Mags, as a nurse in the post-anesthesia care unit, can you describe a little bit about what the recovery is like there and kind of what patients and families can expect?
Okay. Yeah. So once your child comes out into the PACU recovery area, once we get everything squared away initially, one of our goal is always to get parents in at the bedside as soon as possible. And typically what we're monitoring all their vital signs like their heart rate, their blood pressure, oxygenation, how they're breathing, are they comfortable? And we also look at the if they have drains, we will be watching the output from these drains, and we'll be taking care of any pain that they may or may not have, and then any nausea, vomiting that may or may not have. And once all these things are taken care of and we know that your babe is recovering in the right trajectory, then we'll move on to like trying to allow your babe to like start taking small sips of water or juice or whatever it is they're comfortable with, and we'll slowly advance the intake. And then one of our other big goals as well is mobilization. And I mean, it doesn't necessarily mean getting your child out of bed right away, but we do like to see them, even if it's just sitting up on the side of the bed, moving arms, moving legs. All that is just so important to the recovery of your babe, and it just helps everything move along smoothly.
That's great. And is it similar in the intensive care unit? I know you used to work in the intensive care
Yeah,
unit.
it's essentially, yes, it is. It means essentially the same as if once the kids are identified as being part of the ERAS program, yeah, the recovery is the same.
Great. So I know going from the intensive care unit or the post-anesthesia care unit, or PACU, as we've been calling it, it's really important for kids to continue their recovery. And they often go to the acute cardiac care unit, or ACCU, as we call it. Kelsey, as a nurse practitioner in the ACCU, can you tell us a little bit about your role and what your unit's like?
Yeah, so in the acute cardiac care unit, we take care of patients with all kinds of heart disease, and including patients who just recently had surgery and are part of the ERAS program. So out in the acute cardiac care unit is honestly where the patients spend the majority of their recovery. Even if that means they went from the OR to the ICU, then they come out to us once they're ready to leave the ICU, and that's where the bulk of the recovery is. Just like the ICU and the recovery, post-anesthesia recovery unit, you have your assigned bedside nurse dedicated to caring for your child. And then in addition to your bedside nurse, you have someone from the surgical team, an advanced practice provider, which our team is comprised of nurse practitioners like myself and also some physician assistants. And we work closely with the surgeons and cardiologists to optimize recovery and create the plan of care and really enact those ERAS protocols that we've been talking about. So us advanced practice providers are right there on the unit with you and can help prescribe the necessary medications for your child. Sometimes we're part of removing chest tubes and pacing wires when it's time. And then we help prepare your child and you as the caregiver for discharge and coordinate any necessary follow-up. So I think it's also really important to emphasize that we're not only here to support the child in their recovery, but to support you as the caregivers with the child. And so that we can really partner up, work together as a team, and act as cheerleaders for the child as they have to overcome some of the challenges in order to ultimately get better and get home sooner.
So it really sounds like it's a true team approach. How does your team know when it's, time for the patient to go home?
So in order for us to determine when they can go home, we have to focus on certain parts of their immediate recovery. And one of the big things that we emphasize is that pain management. And so we have learned over the years what kinds of strategies can really optimize pain management so that the child can breathe more comfortably. They can get up out of bed and start walking sooner and more comfortably, certainly sleep better and eat better and just overall feel better. So all of these necessary things that need to happen for the patient to get better, for your child to get better, really starts with that pain management. And we've worked closely with the surgeons and the anesthesiologists to kind of have like a bit of a protocol on what to use, specifically non-opioid options like Tylenol and Motrin, but using them in a strategic way so that we can actually control that pain, but then avoid excessive opioid use. Other things that we focus on in addition to pain management is getting those chest tubes and pacing wires that sometimes the surgeons need to place in the OR, getting them out as soon as possible. Because sometimes the chest tubes are not comfortable, but so we really pay close attention on when it's safe for us to remove them. Other things that we like to focus on is getting an echo after surgery to make sure that everything still looks good. And also, again, prepare you as caregivers, answer all your necessary questions, and make sure that you feel comfortable and confident to carry that plan of care out at home. So what their medication schedule looks like and who to contact if there's any questions or concerns.
Great, thank you. So I think some other things.
Sorry. I think I was going to ask a question, but I was muted. Lori, leaving the hospital soon after surgery can be concerning for families. What are steps, and perhaps Kelsey, you can talk about like time frame for going home first, but what are steps that would help families understand today that they're not alone after they leave the hospital?
Yeah, Kelsey, do you want to start and kind of give a little bit of a time frame?
Yeah, sure. So I think what's important to emphasize too, when we, help the families anticipate how long they're going to be in the hospital, it's really difficult for us to say everything's going to happen in, 4 days. So it really just kind of depends on how your child's doing. And we like to think of discharge readiness as more of meeting certain milestones. So sometimes some patients can meet all those milestones as soon as 2 days after surgery. Sometimes it takes a couple of extra days. So some of those milestones are having adequate enough pain control that the family can comfortably and confidently manage at home. Making sure all of those chest tubes and pacing wires are out, having that echo done, having the family have all their questions answered, and then having all the necessary follow-up coordinated.
That's great. I was just going to get into follow-up. Follow-up is so important. So I'm sure a lot of you are sitting here listening and hearing, oh my goodness, my child could go home in 2 days. Not to worry, we do a lot of close follow-up. We have a physician's assistant, or PA as they're called, that you'll do a virtual visit with pretty soon after surgery, usually within a week or so. And then within the first couple of weeks, you'll also follow up with your pediatrician and cardiologist. And then on top of it, as part of the enhanced recovery program, within that application I mentioned at the beginning of the webinar, we do send out recovery surveys, just kind of looking to see how recovery is going, if pain is managed well, and if your child is sleeping and eating okay. So there's definitely a lot of feedback that we're looking for from families afterwards to really help us see how well the child is recovering.
Lori, can you also talk about how feedback helps us improve the program?
Definitely. We love to hear from patients and families. We want to learn about your experience. We want to know what went well, what didn't, because it's really through your feedback that helps shape and improve the program overall. Some examples, we've recently updated our educational material into multiple languages. We've made our website more interactive. We also developed the home monitoring program application, like I said, or in my chart, it's called the Enhanced Recovery Care Companion application. With that application, we added a new option where patients and families can upload an image of the incision directly into my chart. And we do monitor that. So if there's any questions, or if you're just wondering how the incision is looking, how it's healing, you can reach out to us through that. But really, without feedback from patients and family members, we may not have made these changes. So we really want this to be a collaborative process. And again, learn what's working well and what's not, and really just help the program grow overall. Dr. Roy, speaking of growing, can you kind of summarize the results that have been attained through the Enhanced Recovery Program and kind of what's next for the program?
Yes, thank you for that question. I think one of the major things that led us to build on this approach was that really the need for optimization of like the care coordination, so that we all are focused on improving recovery throughout this entire surgical journey that starts at the time of diagnosis, and includes the operative and the postoperative period, as well as recovering so that patients can go home confidently, and feel like they have improved ability to exercise and live the rest of their lives without their concerns for their heart condition. One of the major things that we've accomplished as part of our collaboration is to be able to obtain or to be able to reduce the amount of opioids that we need to provide excellent analgesia by using other medicines like Tylenol and some anti-inflammatory agents during and post-surgery, as well as the regional techniques that have really changed how we are able to manage pain with like the chest thoracotomy type incisions, but even after sternotomies, improve pain management with less opioids. Because when we're able to reduce the amount of opioids used, we're able to mobilize patients faster. They have less nausea and vomiting. Their gut recovers faster. And with that, this is really how we enhance recovery. So I think that certainly in terms of results, that's been what's been the most valuable things that we've seen so far. But I think beyond that, we're starting to think about how to minimize surgical stress prior to surgery, how to optimize certain conditions like anemia before surgery, and how to expand the program in that pre-surgical phase with the help of other Boston Children's Heart Center programs like nutrition and exercise, as well as partnering with our exercise group after surgery to enable patients who have been reluctant into participating into activities to feel like they can feel more confident in those things. So this is where the program is expanding right now. I do think that this approach and the collaborations that we've able to achieve lead to new ideas and making the program better by innovating in different ways.
That's great. So it sounds like a lot of teamwork's involved in the ERAS program, and really empowering patients and families, and also helping patients and families to really be confident. But let's not forget, it is open heart surgery, and sometimes that can be scary. From a psychological standpoint, maybe Margaret, you could answer this. How can kids prepare for an open heart surgery and recover feeling confident during this process?
Okay, thanks for asking me this because this is one of my things that I do like to talk to. A lot of times, like we talk about taking care of the kids and looking after them, but I think it's really important for parents to take care of themselves, like eat properly, sleep properly. I know for myself, if I don't get a good night's sleep, I just don't feel good and I just don't cope as well. And I would say for parents, just whatever you're able to do to sleep and rest and look after yourself, that just really, really helps you help your child to get through this very difficult time. So other little things you can do, like packing a bag, like so you'll have your child bring toys from stuff from home that they're familiar with, that they're going to be happy to see, whatever it is, whether it be their favorite snacks, a favorite book to read, whatever it is that they like to do at home, have some of those kind of familiar things with them in the hospital as well. And another wonderful thing that I do suggest to parents as well is like have a notebook to write down questions because like we as clinicians at the bedside we do give you opportunities, but what oftentimes happens is we've left the bedside and then you remember another question. Whereas if you have a notebook to write down these questions as you think of them, I think it just helps all in all, like just deal with this whole stressful experience of all of this. And also just knowing that we're here to help you. We want to get you through this as stress-free as possible, which I know it's impossible to do that, but we just want to make it as easy as we are able to for you because this is tough.
It is. It's definitely tough, but those are some great tips. I definitely like the notebook. I know myself, I have to write everything down, so it's always very helpful. But definitely some recurring themes we've seen are, really helping kids be confident and prepared ahead of surgery and their families as well. Kelsey, can you name maybe some other benefits of the ERAS program that you've seen?
Yeah, so I think really I think at the end of the day it means that this process is hopefully a little bit smoother, a little bit less stressful, and ultimately perhaps a little bit shorter. As much as we like spending time with you guys in the hospital, really the best spot for your child to recover is at home. So our job is to do everything we can to enhance the recovery so that you can get home sooner, back in your own space so that that healing journey can continue. I think it's also important to note that by having this more formalized group that participates with these specific, patients with these kinds of recoveries, is that we work together as an interdisciplinary group, kind of offering our different perspectives on how to best optimize our program. So that means from the bedside nurse to the nurse practitioner to the surgeons, the anesthesiologist, we all work together within our areas of expertise to see what we can do to make things better for you and your family.
That's great. I definitely see the ERAS program as always, trying to innovate and trying to grow. Dr. Atkinson, from a perioperative and kind of anesthesia perspective, what do you see next?
Well, I think we've communicated, hopefully at this point, that enhanced recovery after surgery protocol is really about a perioperative team using evidence-based practices in a carefully and coordinated fashion to optimize surgery and optimize recovery. So we're constantly looking at the evidence for the practices we use. We're testing what practices are best, and then we decide if we need to refine our protocols. I guess a good example would be with regards to regional anesthesia and the techniques we use. Over time, we've changed which blocks we do for which types of surgeries because we think that some are better for reducing pain and discomfort afterwards. Additionally, the entire team is always looking at how we can broaden the ERAS protocols and apply them to more patients. Patients having different types of surgeries and those with different types of medical problems. In the ICU, where Mags and I and others have worked, Dr. Roy as well, we are are looking at, so there's a group that looks at sedation protocols to try to improve recovery in the ICU. So I think it's a work in progress all the time to maximize the benefits.
Awesome. Thank you.
Before we get to questions, Lori, do you want to just briefly just summarize in a few words, and then we can address some of the questions that were asked by the participants?
Yeah, definitely. I definitely see a lot of excellent questions coming through, but I guess if I had to, describe why I think the ERAS program should be something that parents or patients want to be a part of their care, is because it really empowers patients and families to be actively involved in the recovery process and uses innovative strategies like smaller incisions and new meds, less opioids, nerve blocks. It really helps patients recover and get back to everyday life sooner, as everyone on this panel has mentioned so far. But I don't want to wait on answering some of these excellent questions. So let me see what we have. Oh, this is a good one. Dr. Roy, is recovery protocol any different for an older patient, say older than 18 years old?
Yeah, thank you for asking that question. Obviously, adults who have birth defects that come in for surgery can have, a new diagnosis as an adult, but they can also have had multiple prior surgeries. Even if you've had prior surgeries, you're still eligible for an ERAS approach. It just has to be tailored a little bit. And I think that will address some of the other questions that we have in the chat. So obviously we have a specific protocols for certain patient populations, but it can still be adapted, whether it's an older patient population or a more complex surgery, so that even if the breathing tube is not coming out necessarily at the end of the surgery, it could come out a few hours later after observations. For adults, certainly early mobilization and pain management is really important, but in that setting, sometimes they do need, even after their tubes come out, unlike children, to remain on some opioid medications. We found, though, that the blocks help and that the use of the multimodal pain regimen also helps. So we tailor the approach, even if there's a patient whose recovery needs to be a little bit slower for certain aspects. We do employ the protocols to try to address care in a coordinated way to improve everyone's recovery. So that's sort of what I was going to say about that.
Great. I know you're talking a lot about protocols, and someone did actually ask, are there any protocols specifically for preventing hospital delirium? I don't know if between you and Dr. Atkinson, if you'd like to answer that.
Doug, do you want to address peri-anesthesia protocols?
Yeah, for sure. Certain medications have been implicated or suggested that they are more likely to cause delirium. So that's sort of the point we're talking about here, is where we use medications to not only avoid using those medications, but just reduce the amount of the medications that cause delirium. So a balanced anesthesia or a balanced analgesia regimen can help reduce the amount of medications that cause delirium. But in general, there's many other things that can help with delirium, and especially in the ICU and the intensive care unit. We work to improve the environment so that we reduce the amount of sleep disruptions and the amount of interruptions in their day-night cycle, so that they can stay on track on a normal cycle, if at all possible. Trying to think if there's anything else I'm missing. Do you think of anything, Dr. Roy?
No, I was going to emphasize the need for, minimizing pain, obviously, the choice of medications, like you've said, and the environment. Really, when it's daytime, even if kids are tired, it's important to have the lights, on. And I'm sure both Kelsey and Margaret can speak to that, and have an active time of the day, even if they're recovering, on day one after surgery, so that they can feel tired and fall asleep better at night. So that those are important part of like returning to normalcy after surgery that we implement routinely in the ICU, but especially in this enhanced recovery population. Kelsey and Mags, feel free to add to that as nurses in the unit.
Yeah,
Can
I
we
would.
just say one? Oh, go ahead. Sorry.
Sorry, no, you're good. I definitely agree with what you're both saying about doing everything you can to keep the day and night routine separated, because I mean, sleep and rest are hugely important to recovery. So whatever we can do to help that definitely does help with delirium.
Yeah, and I think to jump off of that too, in the acute cardiac care unit, we try to structure our care around honoring that routine. So if there's any necessary testing like lab draws or x-rays to be obtained, we try to do that during the day as to not disrupt sleep. And then we also try to really cluster our care to honor that appropriate rest time. Um, and also just a structured routine around even something as simple as meals or going to the playroom, to honor that day-night cycle.
That's great. Again, kind of for Dr. Roy, Dr. Atkinson, this is a great question. Does bypass and or stopping the heart affect implementation of ERAS postoperatively?
I can start, and maybe Doug, if you want to add to this, but
Of course.
I think it's really important to say that when we developed this program, obviously ERAS has been around for 30 years, started with abdominal surgery and older patients, that has made its way, because of the results that were so impressive, to all the surgical specialties, and also within a specialty, even as I was saying, for patients who are not necessarily going to have a very simple surgery, there's still elements of care because everything is evidence-based that are applicable to those patients. So what we came up with a protocol that was specific to patients who are undergoing heart surgery. And one of the things that is important in helping us decide if they can have their breathing tube out at the time of surgery or after is, what does the repair entail? So sometimes we can predict it, but sometimes, every heart is a little bit different. So for a similar surgery, some patients, we're at the end of the surgery, we often do the echo to look at the heart function and the repair. But if the repair was a little bit more challenging, for example, we may tailor the approach and say, we're going to observe this patient a little bit longer with a breathing tube in so it can be calm, and make sure that we continue to be happy with the progress before taking the breathing tube out. And even if we take a little pause, we can still regroup and resume if you want the other protocols. So just to summarize, we've implemented or developed a program that was specific to heart surgery, and then are sort of individualizing the approach to each patient and each surgery.
I don't think I have much to add, just to say that absolutely ERAS or enhanced recovery is applied to patients that have surgeries that require heart-lung machine or bypass surgery. Most of our surgeries in the cardiac population do involve heart-lung machine surgery. There's a few that don't, and we have protocols for those populations as well. That includes maybe not going to the ICU, but ERAS is absolutely applied to all cardiac population.
Great. And another question, I know we spoke a lot about getting patients up and moving and mobilizing them, but we didn't mention physical therapy and occupational therapy. Is there anyone, I don't know, and maybe Kelsey, if you can kind of speak to the role of a physical therapist and occupational therapist in the ERAS program?
Yes, absolutely. They are involved in the recovery of your child. Um, Honestly, right as we are putting in the admission orders, that's part of our admission order set is to consult physical therapy and occupational therapy so that they're seeing your child as soon as possible. Again, they're absolutely part of our team for that early mobilization. So you would definitely see them during your stay.
Great, thank you.
I was gonna say that for our older patients or our adults, they're a very critical part of the recovery phase as well, and they're often seeing the patients the day after surgery. In addition to the excellent physiotherapy that's provided by the bedside team, right? You can't forget the nurses who are providing help with mobilization and ambulation. But for those older patients that have the need for extra help, we get the physiotherapist and the occupational therapist to come and see the patients. And I would say that the other aspect of it that is important that we haven't really touched upon, but we have an excellent childcare program here at Boston Children's to help with managing anxiety, peri-procedural, and also in recovery, so that when, for example, the IVs and the lines come out and the chest tubes come out, we really rely on our child life therapists to help distract and help kids cope with the anxiety related to these procedures as well.
Excellent. So I guess the big question, and someone asked it in the chat, why would ERAS not be implemented? It sounds like an awesome program. Dr. Roy?
I was trying to address it earlier, but I think in general we try to include in as many patients in this program, so the patients are screened prior to surgery with their providers, and then even if they are undergoing a complex surgery that is urgent, for example, or if it's a newborn type surgery. The program has really, the program and its results have allowed us as a group, both in the ICU and post-op, in developing and applying a lot of the same protocols or protocols that use the same approaches, even for our more complex patients. I don't know if anyone else on the panel would like to just add on to that.
Yeah, I mean, I think in simple terms, we we call the protocol enhanced recovery after surgery, but it's made up of a lot of different practices, and we can take some of those practices to even the more complex patients that say aren't going to recover faster necessarily or in a really short time period. But we don't necessarily call it ERES at that point, but we're using a lot of the same practices. It's a lot of the same best practices that can optimize recovery either way.
Awesome. I don't know if there's any other questions. Check the chat. So I think that's pretty much wrapping it up. I don't know if anyone has any last minute questions or any last minute things they'd like to say before I wrap it up. No. Well, I want to say thank you to everybody for joining us today. This was a great conversation. Thank you to all the panelists and thank you to everyone at home. We really appreciate all the panelists sharing their expertise and experience with this innovative approach to enhance recovery after cardiac surgery. We hope everyone at home found this webinar informative, and we also hope that you'll reach out to us if you have any questions. You can see here there's a QR code that will take you to the recording. You can watch it there. You can visit our website on the Boston Children's Hospital website. There's a specific ERAS page, or you can even email us. And the email is here, ERAS, which is ERAS at cardio.chboston.org. And again, this webinar was recorded and you'll be able to watch it on Boston Children's Hospital YouTube page at any time. And we thank you again. And remember, we're here to partner with you.